Good morning. Welcome to the second session. It is entitled Empowering Communities and Smallholder Pig Farmers to Rebuild Resilience Against ASF. So as shared by Dr. Dirk Pfeiffer this morning, it's important to share our experiences. And one of them is the keywords that we will use for this second session is community, ASF, and biosecurity. I'm Sarah Jaime, the Animal Health Specialist for FAO ECTAD RAP, working on ASF. And we would like to invite Dr. Tanawa Tenzin to give some messages for this session.
Okay. Very good morning again. Again and again. I think these sessions our colleagues going to discuss on empowering communities and smallholder pig farmers to build resilience against African swine fever. I can tell you that next week on Monday at FAO we call a meeting with farmers, livestock farmers, organization, producer organization, and also private sector, international private sector organization. Because today we can see that livestock sectors, when you're talking about the resilience and sustainability of the sector, is critical. It's not only about transboundary animal disease or emerging transboundary animal disease that occur and really devastated to the sector itself. But some other issues, as this morning we already mentioned, there's some others challenging issues and topics that have an impact to the sector. And that's why we know that over the past years, since avian influenza, you see that today, the price of egg in the US increased more than 1,000% already, from 1.5 US dollar for one dozen. Today is more than 10 US dollar. It's never happened before. And even though the country that have a good infrastructure, have money, but when the system or animal health system doesn't function well, it also can spread the disease quickly. It's the same in Asia when we have the situation or outbreak of African swine fever, what we have learned. And that's why working with communities is critical, because our small-scale farmers, small-scale producers, smallholders, pig producers play an important role. And that's why FAO are working with all the countries in the regions, with our resource partners, and also thank you for the government of Republic of Korea for supporting us. Because we learned from the past, here is a hot spot, Asia. And today, in terms of animal movement, I just came back from Gulf countries and also Africa. More than 10 million animals move around Horn of Africa and Gulf countries or Middle East countries. And just last week, the outbreak of FMD just occurred in Europe. And that's why the situation of African swine fevers in Asia and Pacific, we have learned from Philippines, we have learned from other countries that empowering communities and also smallholders can help us to improve the situation. And that's why today we will share experience and welcome our guests from other countries as well who just joining us. And that's why today we take this opportunity to share experience and good practices, how we can improve the situation. And I'm sure that your experience is valuable. And thank you very much again for joining us this morning. Thank you.
Thank you very much, Dr. Tanawat. And as highlighted by Dr. Tanawat, the importance of partnerships and communities. So for this forum, we will highlight our local government partners and our livestock farmers in the discussion on how to prevent and recover from ASF through biosecurity. To start our presentation, we would like to call our the Animal Production and Health Officer and the ASF Coordinator for Asia and Pacific region, Dr. Yunio.
Thank you, Sai. Well, I will just give a very short introductory for CABI. CABI stands for Community ASF Biosecurity Intervention. FAO developed together with Field Vet Health Services. And we will hear more from our champion farmers and local government partners who implemented in the field how this CABI can be sustained on its own. So, to tackle animal health situation, it is important to make synergies between animal health authority system strengthening and also engaging communities. Our CABI comes to the community engagement part, and we developed the concept of how we can support smallholders, including developing practical guidelines, awareness campaigns, and webinars, and together with CABI work. So, in our region, swine industry, mostly they are in a poor biosecurity. I mean smallholders, but in our region, smallholders are like 70% of household or even more. So with the poor biosecurity, free roaming is still very commonly practiced, and anyone can come in and out to the pig pen, and also soil feeding is very commonly practiced, and without proper waste management. So when we come up with biosecurity, when we hear the wording of biosecurity, we are automatically thinking biosecurity needs a big investment. However, we try to change the software rather than hardware together with a little infrastructure improvement. That's how CABI works. So we designed this study, how CABI can work. This work actually started from 2021. We designed this study protocol 2021, and we had one pilot in the Philippines in 2022. In 2023, we again revised the protocol and adopt into the country context, and we expanded our pilot in 2024. So this community CABI process needs to be really work together with the community through the co-creation process to understand better communities. And our ultimate goal is to empower communities to fight the animal disease situation. Lessons we learned from the field are sustained awareness and education efforts are really working. And also stakeholder engagement is very important to our program. And behavioral change is the best achieved by using participatory approaches. So you will hear more from our farmers and local government partners, how we implemented CABI and how we could improve our practices. And I just wanted to feature this one of the photo I took from the Bais City in the Philippines. Since our program is ASF, we were providing some biosecurity training and also infrastructure improvement of pig pen, which is this right side of the place, the animal pen. And then by learning biosecurity measures, what to do, how to do, farmer invested own money to build the same setting for poultry pen. This is what we really want to see from the smallholder, how we can physically segregate different species and how we can build the biosecurity measure, not only just having multi-million-dollar buildings, but by good hygienic practices. So behavior change is not easy one, but still doable. What we saw from the field, we can really see the willingness from the farmers, and we can reach somewhere successful That's what we hope. We started the pilot in 5 countries last year, but unfortunately 2 countries at the moment are suspended. But we completed the pilot in Laos, PDR, Philippines, and Indonesia. So you will hear more from our friend. So thank you very much. This is the intro, and I will give the floor to Sai back again.
Thank you, Uni. So this is really hearing the voices from the field for the first part of, after the introduction. This will be the sharing of the experiences from our local government veterinary partners who have been there from day one, talking to and coordinating with our farmers and with the different stakeholders at the provincial level. So we will highlight local government partners from 2 countries, from Indonesia and the Philippines. It will be Dr. Hannah Olitioho from North Sulawesi Province and Dr. Ahmad Mike Arianto from West Kalimantan. From the Philippines, it will be Dr. Loida Valenzuela from Ilocos Norte Province and Dr. Melanie Pescadilla from Bais City from the province of Negros Oriental. So to start our presentation, we would like to call Dr. Hannah Olitioho, the Senior Veterinary Officer from the Department of Agriculture and Animal Husbandry from North Sulawesi Province. Dr. Hannah, thank you. Okay. And
Yeah.
who will translate?
Yeah. Thank you for the opportunity give. I'm Hannah from the Department of Agriculture and Livestock of North Sulawesi Province, and I will to try to explain the implementation of the CABI program. We call CABI. Yeah. You know CABI? Yeah. Excuse. Because the pig is chubby. Yeah. Of the CABI program in the North Sulawesi province. But I explain with bahasa. Yeah. But don't worry, we have translator for us. Okay. This is North Sulawesi. Ini sebenarnya ada petanya.
They actually have the maps for this.
So, okay. Kami Sulawesi Utara di ujung Indonesia.
Sulawesi Utara or North Sulawesi is located in the northern part of Indonesia. It's the northern part of
Ya,
Indonesia.
berbatasan dengan Filipina.
And with sharing the border with the Philippines.
Ya. Pertama-tama saya mau memperkenalkan, ini adalah gubernur baru kami bersama-sama dengan wakil gubernurnya.
This is on the right side. You can see the new governors and also the vice governors of the province of the.
Mr. Julius Selvanus bersama-sama dengan Mr. Victor Malengka. Ya. Karena saat ini di Indonesia banyak gubernur, wakil gubernur, dan pemimpin-pemimpin yang baru.
Because currently in Indonesia we have several new leaders for province in a lot of provinces.
Tentunya akan mempengaruhi kebijakan-kebijakan yang ada baik dari peternak sampai pada kebijakan-kebijakan berskala nasional.
Those will affect the policy that will be given to the farmers, and also whether it's in a local or in the national level.
Ya, di Indonesia implementasi daripada CABI program ini di 2 provinsi.
The implementation of CABI program in Indonesia were in 2 locations,
Yaitu di Sulawesi Utara dan di Kalimantan Barat.
North Sulawesi and West Kalimantan.
Dan di Sulawesi Utara ada 3 kabupaten yang dipilih sebagai implementasi daripada program ini.
There are 3 districts that where the program has been implemented.
Yaitu Desa Tiwoho di Minahasa Utara dan Desa Paslatan 1 di Minahasa Selatan serta Desa Pinabetengan Raya di Minahasa.
1 menit lagi, Bu, silahkan lanjut.
Oke. Ya, ini merupakan data daripada populasi yang ada di tiap-tiap desa ini. Lanjut. Oke. Keadaan sebelum CABI program diterapkan.
This is before the CABI program.
Ya, kita melihat di sini sama seperti tadi yang disampaikan oleh Yuni, bahwa di situ akses masuk keluar daripada orang, hewan maupun barang itu sangat-sangat bebas.
You can see the access for the goods, the people is very open.
Ya, dan sesudah ini ada proses daripada intervensinya program CABI. Pertama ada audiens dengan pemerintah.
First is there is an audience with the government, local government.
Kemudian kita menggunakan data dari peternak, apa maunya peternak.
We're collecting the data from the farmers, what they actually want.
Kemudian ada CABI Lounge. Kemudian ada training untuk para peternak sehingga membuka wawasan dan mengubah cara pandang mereka tentang pemeliharaan ternak.
After launching the CABI program, there is a training for the farmers so they can open the, sharing the knowledge and change their behavior.
Selanjutnya sudah dilakukan penerapan biosecurity di masing-masing peternak.
This is the after intervention where finally biosecurity measurement
Ya,
has
dan ini
implemented.
sesudah intervensi daripada program CABI, kita bisa melihat bagaimana hewan, orang maupun barang yang masuk itu sesuai dengan harapan peternak, sehingga mereka boleh terbebas dari virus African swine fever.
This is after implementing the CABI program, they finally implement the measurement, such as the food tipping, septic tank, and this is also according to what the farmers needed.
Iya, dan ini merupakan dampak daripada program CABI di Provinsi Sulawesi Utara.
This is the impact of the CABI program in North Sulawesi.
Oke, ya, thank you very much.
Thank you, Dr. Hannah. Thank you, Devi. So we had a glimpse of how CABI is being implemented in North Sulawesi. Now we would like to call Dr. Ahmad Mike Arianto, the veterinary officer from the Provincial Plantation and Livestock Services of West Kalimantan, Indonesia.
Assalamualaikum warahmatullahi wabarakatuh. Good morning, everyone. First of all, I would like to express my gratitude to FAO and Ministry of Agriculture of Indonesia for choosing West Kalimantan Province as a pilot CABI program. And I would say to Muslim people, happy Ramadan fasting. May this Ramadan giving us more blessing. My name is Ahmad Mike Arianto. I'm veterinarian officer. I'm from West Kalimantan province. In this time, I will share to you about update on CABI implementation in West Kalimantan province. CABI program, sorry, in Indonesia we call it CABI, not CABI. CABI program or community ASF Biosecurity Intervention in West Kalimantan was implemented in 2024 in two area. There are Landak Regency, this one, Landak Regency, and in Pontianak City. The basis for determination for this area, there are ASF-free status to ensure that no cases in these two areas. We conduct sampling and testing ASF collaboration with DIC Banjarbaru. The other thing for site selection is support from local government in Landak Regency in Pontianak City, willingness of farmer, and pig farming as a source of income. We conduct initial data collection in Pontianak City and Landak Regency. In Pontianak City, the number of pig farmer who benefit in CABI program, 53 pig farmer, with total number of pig 570. And in Landak Regency, the number of pig farmer who benefit in CABI program, 31 pig farmer, and with number of pigs 230. And the red one, this is the pig farmer who benefit in CABI in Pontianak City, in North Pontianak sub-district, Batulayang village. And the blue one, pig farmer who benefit in CABI program in Landak Regency in Ngabang sub-district in Amboy Inti village. This is before intervention. You can see the pig number 1, 2, 3, and 4. No biosecurity intervention, no biosecurity installation like no fences, no food dipping, and etc. And we conduct farmer training for farmer with topic cover, introduction of biosecurity, isolation practices, cleaning and disinfection procedure, movement control, and waste management, and feed ingredient and soil feeding. This is after intervention. You can see in number 1, 2, 3, and 4, biosecurity was installed in their pen, like fence, like food dipping, and for hand washing. In overtime, farmer who benefit in CABI program was began implement biosecurity element in their farm, like farmer doing food dipping, farmer washing hand, farmer cleaning the pig pen, and giving the disinfectant. CABI program giving us more positive impact. Until now, in Pontianak City and Landak still free from ASF. No cases ASF in two region. And the farmer benefit CABI have increased awareness with their farm to implication biosecurity. And farmer who benefit in CABI program have learned to improve and to the important for caring and one another. And you can see in graph This is the peak population in Pontianak City from August 24 until January 25 have increased in peak population in Pontianak City. And we will replication CABI program to other area in Singkawang City because CABI program giving West Kalimantan province positive impact to restocking pig population in my area with own budget. I hope FAO can support us again. Thank you.
Thank you, Dr. Mike. So we've seen how CABI or CABI is being implemented in Indonesia, now that's also being expanded to other areas without the support of the project. Now we would like to move to the Philippines and let's see how CABI is being implemented. So we would like to call on Dr. Loida Valenzuela from Ilocos Norte. She is the provincial veterinarian. So Dr. Loida, please.
Thank you, Dr. Sai. Good morning, colleagues in the livestock sector. I'll be presenting to you one of the project sites in the Philippines, and this is located in Katangraran, Ilocos Norte, Solsona, Ilocos Norte. This one is forward. Okay. The red one is Solsona, and the yellow one in the inset is the village or barangay, we call it in the Philippines, where the project site is located. And for the criteria, we have selected smallhold pig farms. Most of them were affected during the time when we had our ASF cases in 2021. And they are very willing to participate in the CABI program. There were 35 farmers that participated way above the targeted for the CABI. Before CABI project, we had this simple housing of the different backyard raisers or smallhold raisers, and we just minimal knowledge and practice of biosecurity. And now, after CABI project, we can see the difference because the pictures in the previous one are the same farms that we have in the second picture. So the farmers identified fencing, vector control, housing improvement, and then fourth is disinfection. They only added foot bath after they have saved some materials from the housing improvement. And I would like to inform that the labor and other supplies were provided by the farmers. And the CABI project with provincial government of Ilocos Norte funds provided for fencing, PGIN provided for fencing, and it also helped in some of the expenditures for housing improvement. So practically, we had to add disinfection and equipment and supply in as much that fencing materials were all provided by the provincial government of Ilocos Norte. Other needs were provided by the municipal local government unit of Solsona, just like what they have for the labeling of the different facilities. For the project impact, community were involved, the barangay village officers, meaning the council, were participatory in the selection process, and as well as in conducting the seminars, they were also given information awareness on the project. And there has been no ASF cases, and there's a decrease in disease incidents in that barangay. There was a positive case in the nearby barangay, but in Katangraran, Solsona, where the project is, it wasn't affected because the people there who are participatory to the project already know what biosecurity is all about. And may we emphasize also that the family members were all involved. If you take a look at the, what's the point? Yes? Yeah. Cannot? Oh, yeah. Oh, sorry. Yeah, here. Sorry. If you notice, this is a boy. helping the family, the father, and these are also elderlies there, who are also helping in the preparation of the and installation of the CABI projects that are to be implemented, the identified interventions. And now we have the local government unit of Solsona with an ongoing policy on biosecurity, as well as with the province for the whole province. And there are also farmers who have replicated CABI installed intervention, not necessarily located within Katangraran, but in nearby barangay. And we have seen recycling, reusing, and repurposing solid and wet water waste, which will be elaborated on later on by our farmer partner. And there's also advocacy campaigns. Some of them were invited to some fora where they became the resource persons about CABI, thus increasing the awareness for biosecurity, not only within the barangay, but in other areas. And biosecurity installed pig farming means healthier pigs and more income for the family, thereby making the community free of disease and happy for that matter. That ends my presentation. Maraming salamat. Thank you and agyamanat.
Thank you, Dr. Loida, for sharing the experience of CABI implementation in Ilocos Norte province in the Philippines. The next presentation will be coming from Dr. Melanie Pescadilla, the city veterinarian for Bais City from Negros Oriental province.
Good morning, everyone. First of all, I would like to say thank you for FAO, USAID, and Ministry of Korea for funding this project and for choosing us one of the CABI sites in the region. And I would like to share with you the glimpse of our CABI implementation. Okay, by the way, this project was the community. Okay, the community site that we chose was previously affected by ASF in July 2023, and due to biosecurity, there has been no cases of ASF since then until now. Okay, so if you can see, we have 4 clusters. We have diverse communities. We have coastal, hacienda, urban, and hinterland barangays. So most Bais City is a 100% smallhold community, so we don't have commercial and semi-commercial farms. And although coastal barangays should not be included, but due to our local ordinance, but we adjusted that policy, so we included that one, provided that that farm is located 1 kilometer away from the coastal area. So, series of community meetings were conducted with the presence of village officials. These are policymakers on the ground to discuss the purpose of the project, their duties and responsibilities, and of course, we want to solicit commitment, full commitment to this project. So this is the real picture on the ground. And I believe most of the third world countries have this kind of smallhold farms. If you notice, it's very ruined because these communities that we have chosen are devastated by tropical storm. All of their piggeries were wiped out. And after a year, their pigs were wiped out by ASF. So we observed these practices before CABI, very poor biosecurity practices with 0 to 1, with 0. When we assessed that one, their score was 0, based on the biosecurity matrix provided by the Department of Agriculture. And most of the farmers were using light or scrap materials. Some pigs were tied under the tree or free roaming. Farmers were not knowledgeable on what biosecurity or how to even implement it. Okay, so the first interventions the interventions that were used. Okay, these are the interventions: repair of pens, fencing of fence, vector control, waste management, provision of food bath, and provision of disinfection kit. So the labor and equity and other materials were provided by the farmers, and the delivery of logistic cost was provided by the local government of Bais and the village officials. So everybody is involved in this project. So the first three interventions were unanimously agreed by the majority, and the project provided cyclone wire, cement, nails, etc. for fencing. And then we also procured pollinets to prevent vectors from going inside their pens, because we identified this during our disease investigation with ASF. So the waste management was identified by the village officials, not by the community, because it is the common cause of problem in the community, and we need to consider that, because these village officials, these policy makers, are very crucial to the success of this activity, or of this project. So to address this project, we provided materials for the construction of septic tank. So CABI project was successful in Bais because of these things. Okay, we have excellent community involvement and cooperation of the community. We've observed their camaraderie and teamwork, especially women who did an excellent job in the decision-making process, such as the designing and construction with the help of their husbands or children in the implementation of the project, which, by the way, majority of our recipients are women. Okay, more than 90%. During our latest audit, so we did annual audit, incidence of diseases was insignificant and almost absent. Thus, the absence of disease challenges and improved animal welfare, the farmer noticed increase in productivity. So we have also observed the majority of the recipients planted materials, that one, so that they will not depend on swill feeding anymore. So that's all. Thank you and good morning.
Thank you, Dr. Melanie, for sharing the experience of Bais City in implementing CABI. Now that we've heard from our local government partners, we would like to hear now directly from our farmer partners, our champion farmers who have directly been involved in implementing CABI. So we would like to call from Indonesia, Mr. Octavian Steve Rembang from the South Minahasa, North Sulawesi Province. Pa. Yeah. And we would like to call on Mr. Filipus Anfri Lagos, from the farmer from West Kalimantan. So here. Okay. And Ms. Roxanne Jane Gabriel from Solsona, Ilocos Norte. And Ms. Leonifel Maninen from Bais City, Negros Oriental Province. And we have our local government partners as our translators for this part of the panel discussion. And we also have the executive director from the Field Vet Health Services, who is involved in implementing CABI at the regional level, Dr. Imelda Santos. It's okay? So thank you again for being here in Bangkok. It's nice to see you, not in the CABI sites. Yeah, not in the field, no? So thank you for attending. Okay. So just relax. They said that they were quite, they have cold hands when I went to their table this morning. Yeah, it's just like us going to the field, no? So we just maybe have one question each for the farmers, and then maybe you can share your experiences with us. So, Ma'am Roxanne, we'd like to ask you, can you please describe the changes you have experienced after implementing CABI?
Good morning, everyone. I'm Roxanne Jane Gabriel from Barangay Katanggaran, Solson, Ilocos Norte, Philippines. The changes I experienced in implementing CABI is mahirap. No.
It's okay. It's okay. Okay lang po. Okay lang.
Mahirap sa simula. Mahirap sa simula pero ito ang magbibigay ng seguridad kung ito'y gagawin ko.
Roxanne says, it's very hard on the first part, but it is also giving us the security if you're going to do that.
Una, sa pagpapalit ko ng footbath araw-araw, noon di ko ginagawa, labas-pasok na lang ako. Yung tubig, the water, I do not get on the irrigation because I know that is one of the reason why my pig is contaminated with the ASF. I have my own boats to enter in the farm and clothes to use. And I have my own septic tank, but the water only get in. But the manure, I get recycled to use fertilizer in the farm so that we less
Kahit Ilocano.
maibabudget namin yung pera namin.
Okay, the first part that meron pa ba?
Araw-araw na pagdilinis, 2 times a day na pagdi-disinfect din. Sa pag-install namin ng vector fence, dito hindi pupunta yung mga insect. Thank you.
Okay, the first one she mentioned about daily change of the foot bath, the disinfectants in the foot bath. The second one, I think she gave it in English, and then there's also an additional Tagalog, which is she mentioned about daily cleaning of the pig pens and disinfection. She said it in English. So, is that it? Okay.
Okay. Salamat. Thank you. Salamat po, Ma'am Roxanne. Okay. Just Ilocos Norte is a northern part of the province of Philippines, and they're known for their pork cracklings and sausages. Okay. Yeah. And maybe I would like to ask, we've heard the implementation at the farmer level, but we would like also to ask Dr. Imelda from the Field Vet Health Services, in terms of implementing CABI at the regional, helping us out and assisting the different local governments. Can you please describe us the challenge just encountered in implementing CABI, and that should be considered also for expansion, since we've heard that most of them are already expanding CABI in other localities? Thank you.
Thank you, Sai. Before I answer her query on the challenges with regard to the implementation or expansion of the CABI program, I would just like to acknowledge the strong support of the local veterinary services, the Bais City Veterinary Office and the Ilocos Norte Provincial Veterinary Office and their respective project implementation teams. We also recognize the counterpart fund support that was provided in terms of sourcing of locally available materials, as well as the logistics and human resource support with regard to the improvement of the backyard pig housing. At the same time, we also appreciate the technical assistance and support of the National Government Veterinary Services, of the Bureau of Animal Industry at the Department of Agriculture for their monitoring and liaison of all the project activities in the field. I think all this support provided the needed impetus to make sure that the implementation of the CABI in the Philippines is successful. I think the main challenge to be considered for expansion would be how do we duplicate this CABI program in other areas in the Philippines with full funding from the local government unit. I think one way to do that would be to ensure that the policymaker or the local chief executive issues an executive order that would require CABI to be part of the annual work and financial plan of the local government unit. This would then ensure that there would be an annual budget allocated for the program. And then I think another way to ensure the sustainability would be to, we could make, like for Bais City and Ilocos Norte and for the other local government unit, we could make the CABI implementation as a requirement before a farmer can avail of any livelihood or program or livestock dispersal program. I think with the successful implementation of the CABI pilot, first in North Cotabato province in Mindanao in 2022, in Bais City in the Visayas, and Ilocos Norte in Luzon in 2024, we are confident that the other local government veterinary services would be interested in adopting the CABI program. Another technique that we could think of is that there is an annual conference of the Provincial City Municipal Veterinarians League in the Philippines, the PCMVLP, another acronym, in May 2025. The CABI program will be presented and repackaged so that other local government units who are interested can apply that. What we will do is we will revise some of the protocols, but retain the protocol on site selection, on the quiz on basic ASF knowledge, what are the adoption of the biosecurity interventions, as well as what would be implemented in terms of the risk factors present in the community. So I think in closing, the field vet health services would like to thank the FAO Regional Office for Asia and the Pacific, the USAID, and the MAFRA of the Republic of Korea for the opportunity to be part of the CABI project in the Philippines. Thank you.
Thank you, Doc Mel, for highlighting the ways forward for CABI. So we've heard how CABI is, the challenges, but also how it's being implemented in the Philippines. But maybe would like to ask also for Indonesia, for Mr. Octavia. Can you also describe to us the changes that you have experienced after implementing CABI? Thank you, Pa.
Terima kasih. Sebelumnya, saya mengucapkan terima kasih kepada FAO.
Thank you for FAO.
Karena saya bisa berada di tempat ini dan kami peternak bisa merasakan bantuan dari FAO yang mendanai program CABI ini.
So that I can be here and I also can receive help because of the CABI program.
Setelah diintervensi oleh CABI, kami merasakan biosecurity di kandang kami, di peternakan kami lebih ditingkatkan lagi.
Silakan.
Dari bantuan-bantuan yang diberikan oleh FAO seperti biosecurity yang dari disinfektan, alat untuk mencelupkan kaki, dan pencuci tangan yang kami rasakan sehingga kami bisa menerapkan biosecurity tempat kami dengan bantuan FAO.
Okay, so after CABI program, he felt that the biosecurity implementation in his farm were like upgraded because FAO gave the disinfectant and then food dipping, and then yeah, thank you for that. Yeah.
Terima kasih, Pak.
Sama-sama.
I know a little. Okay, so maybe we have one last question, and maybe we will ask it from both farmers from Indonesia and the Philippines, but this will be for Ma'am Leonifel and Mr. Filifus. Our question is, what is the one lesson you learned that you would like to share with fellow farmers in adapting the CABI program or the CHABI program?
Good morning, everyone. I'm Leonifel Maninin from Bais City, Negros Oriental, Philippines. Daghan gyud ming nakuha nga leksyon sa CABI project kay sa una bisan kinsa ra moadto sa among tangkal karon nga kabalo na may unsa ang biosecurity, wala na basta-bastang makasulod sa among tangkal. Isip usa ka komunidad nagbutang na mi og mga quarantine areas aron mi makabutang og inkaso magdaot ang among mga binuhi. Naapod mi mga trading area para sa mga komprador. Akong nakatunan ang pagprotektar among babuyan pinaagi sa pagtuman sa biosecurity. Kani maoy among pamaagi aron makatabang sa gobyerno. Daghang salamat.
Okay, so actually, my farmer is so scared and nervous, so he wrote her answers. So I pre-translated this one. Okay, so according to her, we learn a lot from CABI. Before, everybody can enter our pens. Now that we already knew what biosecurity is, not everybody can enter our pens. As a community, we managed and decided to establish a quarantine area for the community. This is our way to help the government in case one of our animals will get sick. And we also provided a trading area for the traders so that they will not enter our farms. And I learned how to protect our farms and our animals from animal diseases by just implementing biosecurity. So, yun. Maraming salamat. So, thank you very much.
Thank you.
I guess she can relax now.
Salamat po. So, Mr. Leonifel, please. So the question is, what is one lesson you learned that you could share with fellow farmers in adapting the CHABI program?
Baik, terima kasih. Baik, terima kasih. Pelajaran apa yang saya dapatkan selama program CABI dalam usaha beternak babi, hal yang paling penting adalah kita harus menerapkan biosecurity guna mencegah penyebaran penyakit seperti memisahkan ternak yang sakit, membatasi orang yang berkunjung ke peternakan kita dan sebagainya.
Oke, stop dulu. Thank you. Same with Philippines. My farmer very nervous. Very nervous. This is my first time show with many people. I will translate. In pig farming, the most important thing is implementing biosecurity biosecurity to prevent the disease. This include segregating sick pig, limiting farm visitor and other necessary measures.
Kami sempat terpuruk dengan wabah ASF yang menyerang peternakan kami. Namun melalui program CABI memberikan harapan bagi kami, khususnya peternak babi di Pontianak, untuk bangkit kembali. Memang
devastated by the ASF outbreak that affected our farm. However, the CABI program has given us hope, especially for pig farmer in Pontianak City, to recover and move forward.
Memang awalnya untuk menerapkan dan merubah kebiasaan itu sangat susah. Tapi dengan semangat dari kita untuk perubahan yang lebih baik, kita yakin bisa karena sesungguhnya usaha tidak mengkhianati hasil. Terima kasih.
At first, it was very challenging to implement change and break old habit, but with our determination for positive change, we believe we can succeed because in the end, effort never betrays. Thank you.
Thank you very much. Salamat po. Terima kasih. Maybe we can stay and then for the closing for Uni.
Well, I'm little mindful for the time. Thank you all for traveling all the way to here and sharing your valuable experiences, and as well also the who's joining in person here. And earlier I saw over 30 people also joined online. I also appreciate for those who joined today. Well, as Imelda already highlighted, local government of 2 provinces already plan to have annual budget for supporting smallholders. Similarly, West Kalimantan also local governments is planning to expand CABI to those who were not involved in this pilot. So we are also mindful how we can make this program more sustained. Then we need to find a way little independent from outsourced funding, because half of this program was funded by the donor we cannot speak of. Then some crises were there. So to overcome this kind of crisis, we can maybe find a better solution. However, this doesn't really necessarily big, heavy investment. Practice also matters, so we can emphasize that. I hope we can bring this as a take-home messages. And thank you so much for today. Maybe this will be the closer. Maybe Jim, you can stop a live stream. Thank you.